BCCNP, British Columbia College of Nursing Professionals. Professionals Nursing Standard 2, Knowledge-Based Practice. Consistently applies knowledge, skills, and judgment in nursing practice. British Columbia College of Nursing Professionals, BCCNP, has set out 4 professional nursing standards. This presentation will discuss the second professional nursing standard, knowledge-based practice. This is addressed by answering the 9 questions put forth by BCCNP on how nurses meet the professional standards in their everyday practice. We use the 13 indicators of clinical practice as well as different case scenarios to show how knowledge-based practice is implemented in nursing care. At the end, there is a skid scenario on what to do and what not to do, which ties all of the information together. This picture is of the questions that BCCNP has put forth about knowledge-based practice in clinical practice. What is a standard? A standard is an expected and achievable level of performance against which actual performance can be compared. It is the minimum level of acceptable performance. So what are professional standards? Professional standards, which are the one set of standards under the umbrella of BCCNP Standards of Practice, are statements about levels of performance that nurses are required to achieve in their practice. The professional standards reflect the values of the nursing profession, clarify what the profession expects of nurses, represent the criteria against which nurses' practice in British Columbia is measured by clients, employers, colleagues, themselves, and others. So what are indicators? Indicators provide specific criteria for meeting each professional standard. How do I incorporate new knowledge and evidence into my practice? This is demonstrated by indicator number 1, bases practice on current evidence from nursing science and other sciences and humanities.
The ways in which a nurse can incorporate new knowledge and evidence into their practice is by staying current with updated science from the multidisciplinary team. A nurse does this by constantly updating their education and showing involvement in the evolving nursing sciences. A nurse needs to stay current with the new policies and procedures that are put in place within their department, the hospital or public health setting where they work, the health authority that they are employed by, and by the provincial and federal government. For example, when new viruses or diseases emerge, being aware of the risks in order to protect ourselves and our patients. The nurse needs to ensure that they read and self-educate all new Fraser Health Bulletin policies and any new educational modules set up by the clinical nursing educators.
What are the competencies I need to work in this area/specialty? This is demonstrated by indicator number 2. Knows how and where to access information to support the provision of safe, competent, and ethical client care.
For a nurse to work successfully in their area of specialty, the nurse must have the knowledge of where and how to access this information. When working in any area of specialty, the nurse must have the knowledge of what is best practice to better support the provision of safe, competent, and ethical client care. When providing safe, competent, and ethical client care, the nurse must look at the Code of Ethics for registered nurses. How a nurse demonstrates ethical care is by using body language and speech that is open and non-judgmental. The nurse should build a nurse-patient relationship that is trustworthy. This is done through conscious effort and involving other members of the healthcare team to bring holistic care. The nurse will only work within their scope to prevent any mistakes, repetitive care, or neglect. For example, take an ER nurse during the COVID-19 pandemic. An emergency room nurse would require specialty training to first become certified to work in the emergency department. Then, through a head-to-toe assessment, the nurse would discover that a patient who is presenting with shortness of breath, a symptom of COVID, would require a focused assessment. This focused assessment would be a tool that the nurse would need to use to discover if the patient needs to have further testing done to determine if they are in fact infected with COVID-19. More so, the nurse would use their knowledge to interpret or implement isolation precautions. They would be specialty trained in how to don and doff their PPE, and an ER nurse would have to have their fit testing and CPR up to date.
How do I make sure my assessments are complete? This is demonstrated by indicator number 3. Uses critical thinking when collecting and interpreting data, planning, implementing, and evaluating nursing care.
For a nurse to make sure their assessments are complete, they must have the proper knowledge in place to know how to do a proper assessment. The nurse needs to use and utilize their critical thinking when they are collecting and interpreting data. They must know the difference between subjective and objective data when interpreting this information. The nurse should use the tools of a care plan to properly organize their data. Using the clinical care plan will help in the organization of their patient's diagnosis to ensure they are making a smart plan and have proper interventions set in place when needed. This also gives the nurse a visual aid in their continuous evaluation to see how the nursing interventions are working or if they need to be adjusted. By having a specific organization plan and checklist for each patient, this gives the nurse the aid they need in making sure the head-to-toe assessment is done in a methodical routine so that nothing is missed. On top of the clinical care plan, the nurse should complete the intentional hourly rounds on each patient and assess the patient for any pain, peri needs, their position, and if they need any of the possessions before leaving the room.
How do I demonstrate critical thinking when planning and evaluating client care? This is demonstrated by indicator number 4. Collects information on client status from a variety of sources using assessment skills, including observation, communication, physical assessment, and a review of pertinent clinical data.
In order for a nurse to demonstrate critical thinking when planning and evaluating client care, they must utilize all of their nursing knowledge and training. How a nurse does this is by collecting the information on the client's status from a variety of sources, including the multidisciplinary team, using their assessment skills, including observations, communication, physical assessments, and a review of the clinical data. The nurse should also have a general pharmacology knowledge as well as anatomy and physiology to better understand the pathology of what is happening with their patients and any interventions that may need to take place. A scenario of this could look like this. A patient faints and presents to the emerge. The ER nurse follows protocol and takes vitals. The patient's blood pressure reads 90/50, and the nurse recognizes this as being hypotensive. The ER nurse is viewing the med rec and notices that the patient is taking 10 milligrams of Ramipril. The ER nurse confirms the dosage and drug with the patient and states her anxiety when visiting her general practitioner's office. The nurse recognizes this as possible white coat syndrome with an elevated blood pressure reading in the presence of a physician. The ER nurse alerts the ER physician, who then orders a dosage decrease with continual monitoring and overnight medication administration.
What resources do I use to support my clinical decision making? This is demonstrated by indicator number 5. Identifies, analyzes, and uses relevant and valid information when making decisions about client status.
Makes a clinical decision, they need to have the resources to back up this decision. A nurse needs to base their clinical decisions on knowledge-based practice. The nurse will demonstrate this by staying current with any changes to the medical field. They will ensure that the information that they are utilizing is factual from peer-reviewed sources, not just from places like WebMD. The nurse will maintain the internal training set in place by the health authority in which they are employed. When making a clinical decision, they will systematically identify, analyze, and use the relevant and valid information they have learned when making a decision about the client status. They will involve the healthcare team to ensure that their decisions are in line with knowledge-based practice. And they will use decision-supporting tools set in place to appropriately assess and make decisions about the client's status and the care plan that needs to be set in place. Tools such as a drug guidebook or a flowchart will aid in these clinical decisions.
How do I develop, contribute to client care plans, and communicate these to the team? This is demonstrated by indicators 6, 7, 8, and 9 of clinical practice. Indicator 6 communicates client status using verifiable information in terminology used in the practice setting. Indicator 7 develops and communicates plans of care that include assessment data, decisions about client status, planned interventions, and measurement of client outcomes. Indicator 8 sets client-centered priorities when planning and providing care. Indicator 9 uses decision support tools appropriately to assess and make decisions about client status and plan care. To develop care plans, nurses must identify an issue with the patient and create a nursing diagnosis. Whenever possible, nurses involve patients in assessment, decision-making about client status, care planning, implementation, and evaluation. Nurses must create SMART goals, which are specific, measurable, attainable, realistic, and timely for their patients, and implement nursing interventions to succeed in that goal. The care plan must be available for the healthcare team to see. This allows everyone involved in the care to know what the plan is for the patient. It is crucial for nurses to do timely documentation and hand over a report prior to breaks and end of shift. Nurses have decision support tools available to them, such as the Braden scale. The tools allow nurses to answer questions and implement strategies to have a better outcome for their patient. When a nurse determines that a patient is high risk as per Braden scale, then they can implement strategies such as turning patient every hour or have the patients up in chair once a day to alleviate pressure off of the coccyx. An example of a SMART goal is have patient up in chair once a day, every day until April 30th to alleviate the pressure on the coccyx and heels. This will get rid of the redness. How do I evaluate outcomes of care? This is demonstrated by indicator 10 of clinical practice. Indicator 10 implements the plan of care, evaluates client's response, and revises the plan as necessary. The picture included is an example of a delirium care plan, which is currently implemented in medicine floor at Surrey Memorial Hospital. Nurses evaluate the care plan frequently. They must compare SMART goals with patient status or progress. Nurses need to determine if the SMART goal was met. Was it effective? If not, then the goal must be revised to ensure it serves the patient. Nurses need to ensure that the patient is meeting any requirements set out by the physician and any other member of the healthcare team, such as the physiotherapist or wound care nurse. An example of this is, patient was assessed on April 30th and found that the redness was still present on the coccyx. This goal was not met. Nurse will need to evaluate the patient's goal and modify it. A new SMART goal is, patient is up in chair once a day and turned every hour, in bed for 7 days to get rid of the red spot on the coccyx. What strategies do I use to keep my documentation accurate, objective, and current? This is demonstrated by Indicator 11. Indicator 11 documents timely and appropriate reports of assessments, decisions about client status, plans, interventions, and client outcomes. To ensure the documentation is accurate and current, nurses must document in a timely manner. For example, vital signs and medication administration must be documented right away. When a patient's acuity, complexity, and variability is high, more frequent documentation is required than when a patient is less acute, less complex, or less variable. Documentation must also be written in an objective tone. Nurses can quote patients. They must ensure it is done properly as per the policy of where they work. It is important to maintain an objective tone for legal purposes. For example, in quotations, patient states that her head hurts, instead of patient's head hurts. The first part, patient states her head hurts, is phrased objectively, whereas the second one, patient's head hurts, is subjective. It is important that documentation is done prior to breaks and shift change. How do I support and mentor new colleagues, novice nurses, and students? This is demonstrated by indicators 12 and 13 of clinical practice. Indicator 12 shares nursing knowledge with clients, colleagues, students, and others. Indicator 13 communicates appropriately in interactions with clients, colleagues, students, and others. Nurse has a duty to support and mentor new colleagues, novice nurses, and students by sharing knowledge and communicating appropriately in interactions. When mentoring, it is important to note that learning takes place in planned learning activities and in teachable moments. Nurses are able to take advantage of teaching opportunities as they occur in day-to-day contact with patients. With student nurses, it is important to know their level of training to prevent any misunderstanding about patient care. For example, a second semester student nurse at University of Fraser Valley is not qualified to do glucose checks, but can give medication. It is important to be aware of the student's scope so the patient's glucose checks and insulin isn't missed. With new colleagues, it is imperative to show them resources and supplies and informing them of any department-specific tools. For example, in maternity, there are specific tools used for hypertensive mothers called the OB-TNT, Trend and Trigger. Another maternity-specific example is when a baby is born, the mom and baby get matching armbands with their own distinct serial number. This is to ensure that the correct mom and baby are together. In this presentation, we have looked at many facets of knowledge-based practice. We delved into their impact on providing the best possible outcome for patients. The next few slides are scripts for 2 skits that our group had hoped to film in the lab at University of Fraser Valley. However, due to social distancing, we were unable to film the skit. Our intention was to use the skit as a summary to show the difference between a nurse who uses knowledge-based practice and one who does not. Sadly, the script does not show different practical pieces that we would have implemented, tools such as the Braden scales, vital signs sheet, bedside environment. In this skit, it does give a general idea of what one would have seen on video. So the scenario for the good nurse skit is the patient is 85 years old, she's female with a stage 2 pressure wound to the coccyx and bilateral heels. She has diabetes and osteoarthritis. She uses the ceiling lift. She has had a stroke. She has choking hazard, dysphagia. The good nurse demonstrates appropriate nursing practice. And here is what a good nurse would do. The nurse would enter the room after performing hand hygiene and introduce herself. Hello, my name is Heather. I am your nurse today. Can you please tell me your name and date of birth? My name is Pradeep. My date of birth is January 13th, 1935. The nurse would verify the patient's verbal information with the patient's armband. Nurse proceeds to do a full morning head-to-toe assessment, including vitals and glucometer checks, as well as focused assessments of pain and properly repositions patient, as patient is a high risk according to the Braden scale. Patient states, my pain is 3 out of 10 in my lower back, hips, and shoulders. Nurse documents vitals and glucometer readings. Nurse communicates with the care aide for patient's morning care to be done and informs the care aide of patient's pressure wound to the coccyx and tells the care aide to apply the triad cream. Nurse also administers morning medications as per the medication administration record, such as patient's regular acetaminophen for her pain, metformin for diabetes, and clopidogrel for her stroke. Nurse documents the medications in the MAR and focus charting following the DARP method in the nurse's notes. The nurse communicates with care aide that patient requires assistance with feeding when the breakfast tray does come. The nurse follows up with patient after breakfast and inquires about the patient's pain level. Nurse goes in the room after performing hand hygiene to inquire about the pain level. Patient states, my pain is now gone. Thank you. This is the bad nurse scenario about what not to do. Same patient. Patient's 85 years old, female, stage 2 pressure wound to the coccyx, bilateral heels, has diabetes, osteoarthritis, uses the ceiling lift, has had stroke, is a choking hazard, has dysphagia. Bad nurse leaves the bed rails down and bed up high, and drags patient in bed and places the food tray and walks away. What not to do. Nurse enters the room and hollers at the patient, hey! Patient looks at the nurse wide-eyed and responds as nervously and sharply, is there any way to greet your patient? Nurse grabs patient's arm without saying anything, starts taking vitals, pinches skin, hard to check for skin trigger, pokes the patient's finger with a glucometer, then sarcastically says, sorry. The nurse, without asking any questions, leaves the room. Nurse neglects communicating with the care aide about the patient's skin integrity issues to the coccyx and bilateral heels. Nurse administers morning medication without doing her 3 medication checks to the MAR and doctor's orders. Nurse neglects communicating to the care aide about the patient's needing assistance with her feeding. Care aide drops tray at the bedside and walks away because he or she is unaware about the feeding requirement. Patient is unable to eat and is very hungry and anxious about not being fed. Nurse also fails to document in a timely manner.